I'm going to say something that's probably going to land a little rough and be highly unpopular in the birth education space. But honestly, I'm always going to keep it real with you guys and be very straightforward. A lot of birth education content is telling you how much your cervix should dilate, or telling you what positions are the best, or telling you why you should go unmedicated. And that's all great and it's necessary. But no one is really talking to you about what actually happens in the hospital, which means you walk in ready for a fight because this group over here told you that if you do all of these things, this is the outcome you'll have. You're told to question everything. Don't trust your OB. Advocate loudly and angrily or nothing would happen. And look, I understand where that comes from. I truly do. And I'm actually a caregiver and I'm always advocating on behalf of my mom. We'll talk about that another time. But I get it. I really do. We all know that there are real gaps in maternity care, real disparities. These are real people who ultimately want the same things as everyone else, a healthy, happy family. But there's a difference between advocating and being adversarial. And what I'm seeing is content that causes a deeper divide between women and the caregivers that are there to help them. Now, ideally, you would have chosen your obstetrician and you know how they work and you trust them. But obviously, we know that's not always the case. So it is okay to question everything. Make sure you have a firm grasp of what's happening with you and your care. I've been on the labor team for 18 years now. I've been in that room. So I understand both sides of what's happening. I've been in the room at the bedside with my pregnant patients. I've been in the room at the bedside with their 24, 25-week babies in the NICU. And I've been in the room with them after they are tired and exhausted after having their baby in postpartum. I also am currently in that room with my loved one. But I'm also in the room with the doctors and the midwives and the medical team making those decisions. And I get it from both sides. What actually leads to better outcomes is not conflict. It's partnership. Informed, prepared, and confident women who feel empowered to speak up for themselves, that know how to communicate with their care team and not fight with them. And that's the gap that I'm feeling. I want you to follow along if you want real birth preparation and information that you can use at the bedside in the moment. Grab the free link in my bio on pregnancy and hospital birth and subscribe.